I want to share this short video with you to remind you of what we talked about during our initial meeting for the Capstone group and to summarize contact with your preceptor. Preparing for your first clinical day, what to focus on during your first clinical day, and then each day after that. You will only have 10 days, so make the most of each day in this practicum. The most important aspect of preparing for your first clinical day is to get a good night's sleep or a good day's sleep. Do get a good sleep before your first assigned shift. Being on your feet in a stressful situation for 12 hours on a brand new unit to you is really different from a regular student clinical day. So rest so you will be your best. Find and have access to handouts from your previous courses regarding normal labs, medications, diagnoses, treatments for those conditions that you know that you will see. Review your basic skills, catheter care, skin assessments, venipuncture, IV starts, IV meds, IV pushes, trach care, all of these skills. There is a S2 skills list in your preceptor's packet. Review that to refresh yourself on some skills that you may have not done. For those of you in a pediatric setting, make sure that you review developmental milestones. Remember to get your uniform and shoes cleaned, patched, stains removed, anything else that is necessary. Make sure that you have your UT Capstone student badge. Remember to have your nails trimmed, your hair away from your face, and pulled back at all times. Early information to obtain from your preceptors. Make sure that you clarify your work schedule, what time to report, what to bring in terms of personal equipment. Ask about meals. You should plan to have a set time or at least a 30-minute break at some point in time. Make sure you find out what's available in terms of the cafeteria being open. Is it even open on your shift? Should you bring a lunch? What's the general routine about meals on the unit? Confirm where to park. Make certain that you park where you are told to park. Find out how to access the unit, either with a barcode, a badge, an agency badge, or other ID. You must have your UT name badge at all times, but you'll probably also have an agency badge that will have a barcode to access certain areas. Make sure that you always have that agency badge and keep it secure. You'll need that to access the various locked areas on the units, and almost all units will be locked at night. But ask your preceptor policies about personal electronic devices. What are the policies about phones, sending and receiving personal messages? A text or a phone message to me about a Capstone situation should not be seen as a personal call. However, your personal calls must be limited to only extreme circumstances. Find out what the unit guidelines are about that. Ask your preceptor about the most frequently seen types of patients or diagnoses so you can review. That will give you an overview of the unit and gives you a heads up on what you need to review for those first few days. When you have your schedule confirmed, notify me via email. We'll need to keep in very close touch about your schedule. Even though I've had contact with your preceptor and checked this out beforehand, there are always situations that we need to deal with, and so the scheduling will change. Make sure that you inform me of any scheduling changes. Be prepared for your first clinical day. This may be in a new facility, different traffic patterns. Make sure that you are on time and ready to go at the assigned time. Day 1 will primarily be a shadowing day. You'll probably not have full access to your agency's electronic charting mechanism, Compass or Meditech or Epic or whatever your documentation program is. So do not plan to give meds on that first day. You may give oral meds if your preceptor approves and is willing to complete the documentation if you do not have access. During the day, check to make certain that your badge works to access areas. If it does not, you will need to notify security to reprogram the badge. The unit educator can be a resource here, but if there are any real issues, then call me 512-971-4823 if there are any real issues. During your first day, try to do a scavenger hunt of sorts. Use those from previous courses, but do find the supplies, the treatment equipment, the meds, the linens, the nutrition. Know where things are kept so you can access anything quickly. Spend time reviewing the equipment in the treatment room or the procedure room. Make sure that you know where equipment is so that you can help during a procedure. Locate the crash cart. Check with the preceptor about emergency evacuation procedures, where equipment is kept for that. Review the emergency equipment on the wall in the room. Talk with your preceptor about that emergency evacuation procedure and what your responsibility would be in case of an evacuation. During your first clinical day, I will visit in person or via telephone sometime during the day. And as part of this conversation, we will review the responsibilities forms and get that form signed. Ask your preceptor to submit the preceptor information form online. That's really the safest and most secure and quickest for her. If you are out of town after we talk on the phone, then scan the signed responsibility form, send us a PDF attachment in an email to me, or if your unit has fax and is willing for you to fax, you may fax that to area code 512-471-3688. During our conversation on your first day, we will review understandings about preceptor absences, about being pulled to another unit, how alternate preceptors will be used if necessary. We will also review the potent medication list. I would encourage you to review this with your preceptor, find out how many of those meds are usually given or sometimes given on that unit so we can have an understanding about that. I will also discuss with the preceptor how I visit and how we will communicate for those of you who are out of town. We will talk about the evaluation details. We'll talk about documentation requests, your log-on access to their documentation software, and really what is feasible in your situation. Again, every unit is a little different. Please don't worry. We will assure that you are able to complete your 120 hours required for practicum in that context. Make certain that you have my telephone number programmed into your phone, area code 512-971-4823. I will have your telephone number based upon your student information form. So if I contact you, you see this number on your cell phone, then that means that will need to talk with you. Call or text at any time for questions, and certainly if your schedule changes or if there is a critical incident of some kind. Remember, do not use the faculty on-call list found in the course documents. Call me or text me regardless of the time, the situation, or who is listed on the preceptor call list or on the faculty call list. Remember, during your first few clinical days, be prepared to call my office, area code 512-232-8264, to give a change of shift report. Do not do it, it's not necessary to do it on the first observation day, but do it for your first few clinical days. Use those guidelines given out at the first day. You may practice the shift report and either give it on the unit before you leave for that day, or you may wait until you are at your home and have some time to decompress, but it really should be done within the first 2 hours after the end of the shift. During these first few clinical days, as you understand more about the unit, we will begin to talk with the preceptor and charge nurse about how to meet those leadership objectives, how you can schedule that, and what the best mechanism will be for you to meet those objectives. And when I visit, either in person or as we talk on the phone, we'll talk about how to complete those objectives. They are really scheduled about the 5th, 6th, or 7th shift. Every clinical day, make sure that you keep a record of your time log and have the preceptor initial that. I would encourage you to keep a clipboard or a notebook or something like that with you on the unit, to keep a copy of the syllabus, keep your time log safe and clean. Remember to keep a blank sheet of paper or something over that for HIPAA regulations. Each day, have specific objectives for what you want to accomplish. This is your experience. Share these objectives with the preceptor, because when I visit, we will talk about how well you are meeting your objectives. I would also encourage you each day to practice clinical reflection of what you did and how you identified and solved problems. Spend some time after the day after you worked to say, what did I do that really was effective? What did I miss? What do I need to focus on for these next few experiences? We will do a mid-semester evaluation during your 5th shift to help you plan for the remaining shifts to ensure that you complete all objectives. So to summarize, remember some general details. If your preceptor calls in ill and you are there, call me. We will see about an alternate preceptor for the day. If the preceptor notifies you that she will be canceled for the day and you want to work that particular day, call me and we'll see about an alternate preceptor. You cannot move with your preceptor to an increasingly acute or higher acuity level, but you can move on a lateral transfer to another unit. So call or text me if you have questions. Remember that you are in essence interviewing for a nursing position every moment you are on the unit, walking through the halls, walking across the parking lot. It does not matter. You represent nursing. You represent the UT Austin School of Nursing. So plan to have a good time, but plan to represent yourself and nursing and the School of Nursing proudly. This is a marvelous, exciting opportunity, and we will be available to help you maximize every possibility and ensure that it is a beneficial experience for you. So please call or text if you have any questions or concerns. Thank you.